Welcome back to another insightful talk at Health Harmony Hub. Alright guys, let's be honest. How many of you have typed how to get bigger into the search bar at some point? No shame, it's a common question. But before we jump into some magic bullet fixes, let's unpack some serious myths floating around. Society loves telling guys bigger is better. Everywhere you look, it's implied that size equals satisfaction. But guess what? Surveys show a disconnect. While over half of men aren't happy with their size, a whopping 85% of their partners are satisfied. Shocker, right? Plus, pornography creates a completely unrealistic picture of what's average. It's like comparing your life to someone else's Instagram feed, curated perfection. The truth is, the average penis is around 5.2 inches erect, and anything within a certain range on either side of that is considered normal. Now, there's a real medical condition called micropenis, which affects less than 1% of the population. But for most guys, the real issue is something called small penis anxiety. It's basically a form of body dysmorphic disorder where you're super focused on your size, causing you stress and messing with your daily life. It can make you feel insecure, ashamed, and even avoid intimacy altogether. Imagine this. You're constantly comparing yourself to others, obsessing over every detail. You might even avoid things like locker rooms or swimming pools because of your anxiety. This is what small penis anxiety can do. It can take a normal, healthy part of your body and turn it into a source of immense stress. Here's the thing. Focusing on size can actually become a self-fulfilling prophecy. Anxiety can lead to performance issues, which can then reinforce the negative thoughts. It's a vicious cycle. If this sounds like you, seeking help is key. Don't trust shady websites promising quick fixes. The Sexual Medicine Society, a bunch of medical pros, clearly states that surgeries for lengthening are not recommended, except for rare cases. Talking to a therapist or counselor who specializes in body dysmorphic disorder can be a game changer. They can help you understand what's considered normal size, develop healthy coping mechanisms for anxiety, and challenge those negative thought patterns. In fact, many men find that counseling alone eliminates the desire for any further treatment. Listen up, I'm not a doctor, and this video isn't a substitute for professional advice. If you're concerned about your size or experiencing anxiety, talk to a doctor or urologist. They can give you personalized guidance based on your specific situation. Therapists can be your allies in battling small penis anxiety. They use validated questionnaires and assessments to understand your perception of size and identify any underlying anxieties. Think of it like detective work, figuring out the root of the problem. One technique they might use is called cognitive behavioral therapy, CBT. CBT helps you challenge those negative thoughts and develop healthier coping mechanisms. For example, if you're constantly comparing yourself to airbrushed models, a therapist can help you develop strategies to focus on what truly matters: communication, intimacy, and a healthy relationship. The good news is that counseling has a high success rate. Many men find relief from anxiety and no longer desire further treatment. Alright, let's talk about some of the options you might find online. Penile extenders are devices that kind of stretch your penis over time. The idea is that by applying gentle traction, you can increase length. Sounds easy, right? Well, there are a few things to consider. First, the science is shaky. Studies show limited expected gains, maybe around 2 centimeters at best. That's less than an inch, and it requires consistent daily use for months to see any results. We're talking hours a day, every day. Think about keeping up with that kind of commitment. Second, there can be side effects. Numbness, bruising, and discomfort are all on the table. Not exactly what you're looking for when it comes to a sensitive area. Plus, if you don't use it consistently, you probably won't see any changes at all. The bottom line on extenders, they might offer a small gain, but with limitations and downsides. If you're considering this route, talk to a doctor first and weigh the risks and rewards. Next up, vacuum erection devices, VEDs. These are those pumps that create a vacuum to draw blood into the penis and cause an erection. Now, VEDs are helpful for men with erectile dysfunction, but they won't make your penis bigger. They simply help you get and maintain an erection. There can be some benefits though, like improved blood flow, which can be helpful for maintaining an erection during intercourse. But again, size increase? Not gonna happen. Okay, So we've covered non-surgical options. Now let's talk about surgery. This is where things get a little risky. There are a few surgical procedures out there that claim to increase penis length. Here's the thing. Most of them have poor outcomes and a lack of strong recommendations from medical professionals. The studies done on these procedures are often small and lack proper control groups, making it hard to say if they're even effective. Plus, surgery comes with inherent risks. Infection, bleeding, and scarring are all potential complications. And let's not forget the possibility of permanent damage. Is a slight increase in length worth the risk of disfigurement or erectile dysfunction? Probably not. One procedure you might come across is called a suspensory ligament incision. This surgery involves releasing a ligament that holds the penis attached to the pubic bone. In theory, this can add a small amount of length. But here's the catch. The results are often unpredictable and not very impressive. Plus, there are potential complications like nerve damage, bleeding, and altered appearance. Is a minimal gain worth the risk of permanent nerve damage or a crooked penis? Absolutely not. There are other, more complex surgical techniques like flaps, grafts, and even using rib cartilage. But here's the deal. These procedures are even more experimental than ligament incision, and the risks are even higher. The data on their effectiveness is poor, and the potential complications are significant. The bottom line on surgery: surgical procedures for lengthening are generally not recommended. They offer minimal benefits with significant risks. Unless you're part of a well-designed clinical trial with proper oversight, avoid these types of surgeries altogether. Now, clinical trials are a different story. These are research studies that aim to evaluate new treatments in a safe and ethical way. They have institutional review boards that make sure everything is safe for the participants and that all the data is collected properly. This is how we get real information on what actually works. If you're interested in being part of a clinical trial for a new penis lengthening procedure, talk to your doctor. They can help you find out if there are any trials ongoing that might be a good fit for you. Alright guys, let's recap. There's no magic pill to make you bigger. Penile extenders might offer a small gain, but with limitations and downsides. Psychological counseling is the best first step to address anxiety and develop healthy coping mechanisms. Remember, unproven or risky treatments can leave you disfigured and unable to get an erection. If you are struggling with small penis anxiety, please reach out to a healthcare professional. They can help you manage your anxiety and improve your quality of life. You are worth it, and a healthy relationship focuses on more than just size. Here are some tips for taking care of yourself and your sexual health. And maintain a healthy lifestyle. Eat a balanced diet, exercise regularly, and get enough sleep. These habits can improve your overall health and well-being, including your sexual function. Practice good hygiene. Keeping your genitals clean and healthy can help prevent infections and improve sexual satisfaction. Communicate openly and honestly with your partner. Talk about your sexual desires and concerns. Open communication is essential for a healthy and fulfilling sex life. Explore other forms of intimacy. Physical intimacy isn't the only way to connect with your partner. Explore other forms of intimacy, such as cuddling, kissing, and emotional connection. Remember, you are not alone. Many men struggle with body image issues and sexual anxiety. There is help available, and you don't have to go through this alone. If you're interested in learning more about healthy relationships or sexual health, check out the resources listed below in the description. If you enjoyed this video, hit that subscribe button for more informative content on men's health. Thanks for joining me, guys. Take care of yourselves, and remember, you are worthy of love and happiness. More engaging content. Your support helps us continue to unravel the mysteries of human relationships and emotions, one episode at a time. So hit that subscribe button now and join us on this journey of discovery and growth.